Good afternoon. Thank you so much for joining us for our January Children's Women's Research Lunch and Learn session. Just give a couple seconds. There are people still trickling in from the waiting room. There we go. Okay, I think we've got everyone in. Okay, so just want to start by gratefully acknowledging that the work that we do at BC Children's Hospital Research Institute and the Women's Health Research Institute is located on the unceded, traditional, and occupied lands of the Coast Salish peoples, specifically the Musqueam, Squamish, and Tsleil-Waututh nations. And we're very grateful for the opportunity to live, work, and learn on these sacred lands. And for January's Lunch and Learn session, I'm really excited to introduce Jennifer Clayton, who is my boss. So Jennifer is the Director of Clinical Research Operations at BC Children's Research Institute. She's been facilitating research for more than 25 years and brings extensive experience in the conceptualization, setup, and execution of a wide range of clinical research studies. Throughout Jennifer's career, she's supported investigators and research teams in navigating the operational, regulatory, and methodological aspects of conducting high-quality research. In Jennifer's current role, she's dedicated to strengthening the overall quality and impact of research conducted within the organization. Her work focuses on improving efficiencies, building sustainable research infrastructure, and expanding education, training, mentorship, and access to specialized support services. Jennifer is committed to fostering a positive and collaborative research culture. And I'm really excited to hear more about the IRAP initiative that Jennifer has really spearheaded at Children's and Women's and is going to be presenting on today. So we'll turn it over to you, Jennifer, to hear more.
Thanks so much, Shanley, and thank you for that very warm welcome. All right, I'm going to start by sharing my slide. Okay, great. I'm really excited to be introducing the IRAP system, which is going to be CNW's new institutional research approvals portal. I'd just like to acknowledge before I start that none of this work would be possible without the help of Siobhan Hughes, who's the lead for data management with the team here at the Research Institute. She's been instrumental in helping with this work and moving this forward. So I'm sort of presenting this on behalf of both of us. So I'm just going to start at the beginning. Probably most of you are aware and familiar with this already, but want to make sure that we're all on the same page. So you all know that there's 2 requirements to conduct research on site here at Children's and Women's Hospital. All studies require research ethics approval, which is focused on ensuring the rights and welfare and well-being of participants included in the research. And then the second aspect is institutional approval. So institutional approval is focused on ensuring that studies can safely and feasibly be supported within the programs at the hospital and across the institution. It focuses on the resources, the logistics, and the impact of the study happening on our site. The current process for institutional approvals is outlined on this website here, which includes all of the forms, the program and resource utilization forms for the different program areas. It's a paper-based form, so study teams fill out the form, and then they have to figure out who is the appropriate signatory on the form, obtain the signature, and then forward the form to the Research Ethics Board. Research Ethics then collates all these forms, ensures that the study team has requested approval from all the right programs, and then once all the program approvals have been obtained, they will issue a certificate of institutional approval. So that's our current process. When we started looking at this, we started having conversations with research teams as well as with program leaders to understand what are the challenges with the current process that we have. So from research teams, we heard a number of things. We heard that there's often no standardized process for how approval happens within certain program areas. And if there is a process, there's often lack of transparency around exactly what that process looks like. Research teams also told us that it's often really unclear who needs to sign the form. Sometimes there's multiple leaders within a particular area that can sign the form, and so they get signature from one individual, but didn't know that they need approval from another individual as well. This can create some challenges with approvals because approvals are then granted, but then study teams run into challenges when they start to actually initiate the study because not everybody who needs to know about the study has been informed during that sort of approval stage. Research teams share that they're often unclear on what the program expectations are when they're setting up a new research study. Again, sort of a lack of transparency and understanding, and poor communication with program leaders. On the program leader side, we hear that leaders are really wanting research teams to engage leadership earlier in the process, particularly if they're implementing research in an area for the first time. Leaders also often say they, would value the opportunity to be consulted or engaged in how recruitment processes might happen or what interaction with the study team will look like. They say they're often unclear about how many studies are actively ongoing within their own area. Sometimes they're informed when a study starts, but they may not be informed when a study ends. So they don't know how many studies are actually active at any given time, or if there are any considerations for multiple studies happening at the same time. They feel that not everyone is informed when a new research study starts and that there could be improvement about ensuring that all the clinical team is informed about the study. Also, there's no communication when the study ends. So the study runs in the program, but then the program doesn't usually get to hear the benefits of the research or what happened next after the research was finished. And there's sort of a feeling of I don't know, sadness isn't the right word, but the sort of feeling like, oh, there's a disappointment or an opportunity lost there where the program didn't get to hear about the outcome of the research. And generally, they commented that they feel that there's often poor communication with research teams. And I will say that this is not universal across all program areas. There are certainly program areas and research teams that are well connected and do very well. This was just more us focusing on understanding what the challenges are. But I recognize that it's also important to understand the benefits or the things that are going well, especially if we want to think about making changes in other areas, taking kind of the things that are working well in some places and implementing them in other places where things are maybe not working as well. So with this information, we then started to think about what would be the requirements that we would need if we started to move from having a paper-based system into an electronic system. And we created a bit of this list around what we would require in that electronic system. So one of the things that became really clear was we need standardized processes. We need a clear pathway for approval within each program area. And we needed program flexibility because we know that programs have different ways in which they like to approve studies. Some programs have a research oversight committee. Some programs have a dyad signing off. So there's variety in how studies are approved across the hospital, and that program autonomy basically to decide what that looks like within their program is really important. We also needed transparency on the status of applications. So being able to be very clear what programs have approval, what programs are still pending approval long-term. Accountability for approval timelines. So ensuring that research approvals don't sit on somebody's desk for weeks and weeks on end without being reviewed. We need to have accountability and ensure that those timelines can be met appropriately so that research studies can move forward and are not delayed or stalled unnecessarily. We're looking for a system that would improve communication between research teams and operational leaders by making everything available in one place with clear transparency and accountability. We needed a system that could be customized to our site and something that could be changed down the road. We know that operational leaders are often turning over. We know that staff in research teams are turning over. So we need the ability to be able to update and change those kinds of things and be able to add new customizations or new things that we need to the system as we learn and continue to grow. We want to have metrics on the number of active studies, so ensure that programs then have that information in terms of what studies are active, what studies are closed, or what studies are in the approval state. Automatic routing and email notifications, so taking that burden off of study teams to identify who is the appropriate leader, and be able to say, submit your application electronically, and it right away lands on the desk of the appropriate person, rather than getting study teams to try and figure out who is the right person to sign off. The ability to communicate any study updates or when studies close, again, sort of that real-time tracking of where things are at. We needed a solution that was going to be fiscally sustainable on the long term, and something that we had sort of autonomy and ability to, again, customize and change in the future. And we really wanted a single electronic platform, so moving away from this need for multiple forms and having one single system. So there's actually been a lot of work leading up to where we are today. So I just wanted to kind of cover a little bit about that. So we really started this work in 2019 when we started talking to programs and understanding the processes and the challenges. I would say there's a little blip in there in 2020, but we did eventually pick up the work again. And in late 2022, we launched EPUP, which stands for the Electronic Program Utilization Portal. So this was a software system that was built in-house by our IT team here at the Research Institute. And we included just 3 programs: the Clinical Research Evaluation Unit at the Research Institute here, Pediatric Emergency Medicine, and Mental Health. And the intention of this was really for us to just pilot something real world and gather some data and information about what does this look like having an electronic system in the real world. And we learned a lot, I would say, through that work. One of the things that became very clear to us, this system was built on a system called Apex. And one of the things that became very clear to us at the end of this was that we weren't actually going to be able to scale or expand the system the way that we wanted to. So after a period of time trialing this, we realized that we actually had to look at an alternate solution if we wanted to make something site-wide. So in the years that followed, we then started to explore a number of other different systems that we might use, including some commercially available systems out there. One of the other things we did is, from feedback from the community, a lot of people said, well, why can't this be part of RISE? Could this somehow be embedded? There's a lot of overlap between the information that's put into RISE and information that's needed for operational approval. So we did actually explore that. We met with the RISE IT team and advocated to leadership to do this. There were some challenges that made that unable to be a real solution moving forward. And so unfortunately, at the decision that was made was that we weren't going to be able to integrate this into RISE for a number of different reasons. And so we then sort of went back to the drawing board to think about, okay, if we're going to build something locally here again, how do we go about doing that? And we eventually landed with the REDCap system and thinking about REDCap as extremely customizable and adaptable. And we have expertise in-house who can help support build or change that's needed. And so we started building the new IRAP system in REDCap. And that is where we are today, where we're getting ready and preparing this year to launch the system. So that's the long backstory. So here we are today introducing IRAP. So IRAP is an online submission for research approvals from multiple different program areas via a single application in REDCap. As I mentioned, that was built in-house. For the launch this year, it is going to be a hybrid model. So we have some programs that we've fully integrated and built out into IRAP with full automatic notifications and emails directly to the program leaders. But we have other programs that we haven't yet built into the system. And so rather than waiting to have all program areas across the hospital built into IRAP, we decided that we were going to move forward with launching this hybrid model system where we will have some programs built in the system and some programs will continue to use the paper PUF forms, and research teams will upload those PUFs to the system rather than emailing them to the Research Ethics Board. The intention very much is that this is completed in parallel with your REB submission and that if necessary, you can copy and paste relevant information between the two. Again, unfortunately, we weren't able to make a connection or a link between RISE and the REDCap platform. So there are some questions related to recruitment that are relevant on both sides. And so as much as possible, we've tried to make it so that you can just copy and paste and you don't have to rewrite those aspects of it. And our goal is to launch next month. So what studies require IRAP submission? So this really doesn't change. It's the same as the current process right now. Any study that involves C&W patients, any study that involves C&W staff, or uses PHSA data from C&W, or uses C&W property, resources, or facilities for any part of the study. All of those studies will require institutional approval before and will still require institutional approval through the IRAP submission. One other important note is around who can submit on IRAP. So every study must identify a site principal investigator who holds membership with the Research Institute or a clinical appointment at Children's or Women's Hospital. So if the study PI is not within that category, they must identify a C&W co-investigator who will be the named site PI on the submission. The other note is that it may require that the PI or co-I has a C&W clinical appointment. And I say may because I would say for 98% of studies, most studies that require C&W research ethics review that are happening on site here with patients, where patients are the primary participant in the study, do require at least a co-investigator with a C&W clinical appointment. There are a few exceptions to this rule, particularly studies that might be targeting staff rather than patients. So that would sort of be reviewed on a case-by-case basis. I am going to give a little bit of a demo of the system later in the presentation, but this is just a schematic of what the process looks like. So the study team will submit their IRAP application through the online portal. There's an institutional screening step similar to what currently happens now once you submit to ethics. All the programs that have been built in within IRAP, they will be sent out after institutional screening, and the review will happen within the system. There is a dashboard that is updated as programs approved, so study teams can visit the dashboard at any time and see the status of the programs and the review, where they're at with their review within the system. Simultaneously, study teams will obtain paper program utilization forms for any of the programs that are not built into IRAP at the moment, and they will upload those forms to the dashboard. The study team then also will upload a copy of their RAB approval certificate once that's been issued, and then the final institutional certificate will be released. The dashboard, I think, is a really exciting feature of IRAP because this is really where study teams and programs can have a real-time visibility on the overall status of their application. It clarifies which programs the approvals will happen within IRAP and which programs will need to have a form uploaded to. So again, this is the place really where there's transparency in what is complete and what is outstanding for study teams. So next I was going to switch and show a bit of a demo of the system, but maybe I'll also just take a moment there to pause and see if there are any questions or any things that I could clarify if anybody is interested. Julia, go ahead.
Hi, thanks for this. The point about having to have a PI from one of the research institutes as an investigator is quite a big shift. And I'm wondering what the rationale for that is.
The rationale is we really want to know that this person is within our community. So if the investigator who's leading the research is not within the CNW community, then it's important that they identify somebody that is and collaborate with them.
So a clinician, a full-time clinician at Children's or Women's wouldn't be able to submit.
Yes, they would be able to submit. Yes.
They're not a research institute affiliate necessarily.
You're right. If they're not, so the caveat in this slide that I can share was or healthcare or a clinical appointment at Children's and Women's. I think I think there's a good chance that anybody who's doing research or doing a lot of research would potentially be connected with a research institute. Or if they're not, I might ask that question as to why they're not connected with.
I'm in an operation role. I sign off a lot of PUFs almost every day, and I would say a third of them, there's not a research institute affiliate of the PI. Okay. Because we support all our trainees, fellows, all of these projects that go through hundreds of projects a year, and they don't go through the research institute. So I guess I'm just not sure, maybe the people who've made these decisions don't have awareness of that. I'm not saying I disagree with it, but it'll need a bit of work. I'm sure we're not the only program that this would be relevant for. It's a big shift. So I think it just will need some messaging around the why that, and I'm happy to communicate what messaging comes and support it as a decision, but it just needs to be thought of as a change in practice. That's not just about using a different format of submission, but it's an actual different requirement.
So that's I'll just say that's not our intention. So the intention is that there's somebody within our community. So that is somebody within the research, connected with the research institute and or has an appointment at Children's or Women's. I understand that trainees also might not be in that position, but I guess if the trainee was the PI, that they would potentially have a co-investigator who does have a clinical appointment.
Okay, so clinical appointment's okay. It doesn't have to be a research affiliation.
Yes.
Okay.
Yeah, they have to be part of the CNW community.
Yeah, okay.
As demonstrated by one or the other.
Yeah, perfect. Thanks.
Yeah. The real intention is that, for instance, if there's an investigator, say in London, Ontario, that is doing a study, and they are actually, say it's a multi-centered study, they're the lead PI, they're not the person who would submit the IRAP submission. They would have to identify a PI within our community who would then submit it on behalf of them, if that makes sense. Thank you for asking the question, though, because it is an opportunity to clarify. Yeah, Matthias.
On one of the slides, you mentioned any study that uses data from CW. And in the past, there was a differentiation to be made between things where we needed paper records, in which case we got health records approval, and things where we could just do chart reviews on Cerner. Will this new system require additional Cerner clinical informatics approvals for chart reviews, or is it simply sufficient to have the same as before, where the operational leader for the program that this fell into said this is fine?
Exactly, the latter. So the reason for the requirement for if you're using data is so that the program is aware that you're using their data for this retrospective study. Does that make sense? One of the things that we have also done within IRAP to help even the research staff navigate the landscape, things like data. So if you're looking for data through DARE, DARE's not built into REDCap, is not built into IRAP at the moment, but there's a link that says, if you're looking for this data, here's where you go to fill out the form that's required for DARE. So we have tried very much to build this in as a bit of a navigation step as well to help study teams, even if the program or approval is not directly built in, that at least we can point them in the right direction. Vic.
Hey, Jennifer. Quick question, if and it feels like it's more of an adjacent question and not specific to this conversation, feel free to defer it to a different meeting. But one of the things that, as I've in the old system tried to navigate, was all the different program utilization forms. And, the gap that I've noticed was that it's unclear when a program utilization form is needed, for example, for a chart review, because it's all electronic and all accessible and um, and that has implications about like particularly if you're doing data sharing with other people and stewards signing off. And I'm never clear what needs data steward sign off, what doesn't, how does that integrate in? There's no utilization form. There's no clear process for getting um, the data stewards to sign off, except if you're using DARE, because then they will escalate to the data steward for you. And so if you don't need DARE, there's really no mechanism to, or I shouldn't say there's no mechanism. I am unaware of any mechanism. And does that play into the system, or is that like so far left field that we should have that conversation in a different venue?
No, I mean, it's exactly to your point, Vic, that some of these questions are unclear, unanswered, not transparent. My current understanding is that the when you're using data within a program, say that you have access to because you have a clinical appointment as well, it's really just important to inform leadership what you're doing with that data. Just in the interest of transparency and sharing that it's clear, kind of to my point earlier, that research data gets returned back to the program from which the data came from. And so in that case, you would complete your IRAP submission, you would identify the program from which data is being collected, and approval would happen through the program.
Okay.
And it creates a very transparent situation too for the programs to understand how many times is their data being utilized, how many times is prospective recruitment happening within their area. So it will have some of those nuances in data surrounding that.
Interesting. So I guess the implicate or the interpretation is then that the data steward for that area is the approval body of that area. So like for the emerge, which truth be told, any study we do through the emerge is emerge data. The approval body is PEMRC is the data steward for emerge specific, and actually it doesn't necessarily have to go higher up unless it's being transmitted elsewhere and a DTA needs to be executed kind of thing.
Siobhan, did you have a comment on that?
It depends on what you're doing. I mean, technically, like if you read the Cerner guidelines, if you're accessing a chart for anything other than clinical care, you need to actually indicate that when you open a record. There's like the research,
Yeah.
non-research thing, and
Yeah.
you are supposed to have approvals, and you are supposed to have like your access for research to Cerner is actually governed by a specific REB application with a specific expiry
Yeah.
date attached. So in that case, if you are looking at a patient chart for anything other than patient care, you should have an REB application attached to that. You should
Yeah.
have approvals in place. So, but if it's going into the QI aspect of things and you're doing this, and then you need to talk to your medical and operations leadership, which PEMRC, I'm not sure exactly who that is off the top of my head,
Yeah.
but it wouldn't be the research council because if it's QI, it's separate, but you guys kind of are mixed together. And then potentially if you're documenting that data anywhere, that then needs to go to the DCSSC, which also then reports back up into Sarah and Cheryl. So it's a
Yeah. Oh, that's you're speaking now from the QI perspective. Yeah.
yes. So
Yeah.
it
Yeah.
depends
Yeah.
on what you're doing.
Yeah,
But
no, I
if
was
you're
thinking specifically from the
research,
research and that, yeah, sorry, the automatic assumption is that you would have REB. Like I didn't say it because I just assumed you would have REB. So I think the point is you need your REB approval, which is attached to those specific H numbers, and then the subset of patients, and then whatever operational approval within your division. And it's like a
yeah.
two-header, but REB is one of them. Yeah.
Yeah, there is a section in IRAP where you're asking if you're going to be accessing charts within Cerner, and then that kind of has its own level of things, and then you kind of depending on the program area, but the program should be aware because if they're ever audited, they need to be able to answer the questions of why is Vic going through all of these charts? You
Yeah.
know,
Yeah. So really, I guess the point is that all retrospective chart reviews should go through divisional operational approvals as well as the answer, not just those that impact operations. Okay. Thank you. Very helpful.
And that should be the case right now. So that's not a shift or a change from where we are currently. William and then Heather.
Thanks very much. This is obviously a lot of effort to put together, and I applaud your efforts in that regard. If I may then ask, of course, one of the challenges that is known in this system is the circularity of the arguments. From, the ethics won't sign off until you've got the program utilization forms done, and the program utilization form signer offers won't sign off until ethical approval is done. So there's no system that's going to make that go away unless and until everyone in the REB and all program leaders incorporate within their very souls the idea that this process needs to go in parallel. It is not a process that happens in series. So if there's a program utilization form that lands on a leader's desk, they should review it in good faith with, yes, we know ethics will be coming down the pipeline, but there can't be this business of people waiting for, it's got to be okay with your mom before it's okay with my mom. So
absolutely agreed. And actually, as I've been talking with programs about this, and because this is definitely a concern of theirs, one of the things we've kind of done to help clarify this is to distinguish what is approval activity and what is activation activity. So this is very common in some of the service areas in particular, so lab, pharmacy, medical day unit, where they are granting approval, but what they're granting actually when they sign that PUF is a conditional approval. They're saying if you get REB approval in place, if you get your CST Cerner or whatever the program requires in place, if you have all these other things, then you can activate your study here. And so we've talked very much about that. So within IRAP, you'll see individual programs granting approval, but you will not actually receive your institutional approval until you have all the checks done. And then that is your go live, your green light to go forward, essentially, with starting recruiting patients.
Yes, I appreciate that. So yeah, I mean, keeping a clear separation between ethics, which is a philosophical space, and mechanics, which is the approvalicious approvals that come through, would be great. Thanks very much for your efforts in this space.
Yeah, agree wholeheartedly. The operational review is really intended to be an operational review, looking at logistics and feasibility and ensuring that the study team can integrate with clinical workflows. It is not looking at the ethical aspects of the study.
Thank you.
Heather.
Hi, I just want to clarify that I'm understanding the system correctly and wondering about when a conversation should take place with leadership, because in my experience, they prefer the conversation to receiving documents. So is the process that we fill out the PU forms on IRAP and then leadership gets sent an email to sign off? And if that happens, when should we integrate a conversation with leadership so that they can ask us questions and understand what they're signing off on and make revisions and things like that, which usually is, happens in a meeting or kind of throughout the flow of negotiations and discussions. And then usually at the end, I just go and, okay, we've agreed, now everybody sign, and we're good to go. So I'm wondering if this is going to get lost in people's inboxes because their inboxes are really quite busy, and how you expect this integrating with the kind of human aspect of approvals as well.
Great question, Heather. Thank you for asking it. And I'm going to actually divide it into two answers. So I think to your point about leaders, what point do I go and start that conversation with leaders about a new study that I'm thinking about in a particular area? And I think if you have no experience working with the leaders in that area, it's really important to reach out early. In fact, you probably want to reach out well before you're submitting to IRAP and maybe even well before you're submitting to ethics. Because I think one of the worst things that you can do is create a plan and a recruitment strategy. And this is how the research team is going to do things. They submit that to ethics. They submit their institutional approval. And then the leadership comes back and says, you can't do that in our area. That's not going to work. That's not feasible. You need to do it like this. And now you've gotten ethics approval, so now you have to submit amendment and do it over again. So I think when we're working in new areas with leadership teams that we haven't worked with before, it's really important to engage early, have those conversations early, and maybe even come up with what does recruitment look like within the unit? What does it mean for a research team member to come into the unit and meet with patients and families? When is the right time to do that? How would that work? And have that and figure that out essentially before you then submit, so that by the time you're coming to do your ethics submission and the time you're coming to do your IRAP submission, which should happen in parallel, you already have a clear knowledge that the research recruitment plan or the plans that you've made will be accepted by leadership. I think if you're working in an area all the time and this is just another study and we're going to do it the same way we did our previous study, you probably don't need that conversation in advance. You can just submit directly through this and get approval for your study specific, but that's going to depend on the relationship that you have with your existing leadership.
Okay, thank you for clarifying.
To your next, because I feel like the next part was then, okay, now I've submitted, now what happens? And to that point, I think this is one thing we definitely learned in developing this is the importance of flexibility within programs to determine how they do this, because we do know that some programs do have a committee review, or as Vic mentioned, they have a research oversight group. So there will still be a meeting. For instance, I know Medical Day Unit, for instance, does an operational impact meeting. So they actually will, once you've submitted on IRAP, they will actually reach out to you and hold a meeting or have a committee meeting or have you come and present to the committee, whatever the requirement is. And your application will sit under review during that time period. And then once the committee is finished and done, any feedback or any changes that might be required would be inputted into the system and then communicated to the study team that way.
Okay.
We do want that flexibility. Finally, to your last point about this just sitting in somebody's inbox instead of sitting on somebody's desk, absolutely a concern, at risk that we are aware of. And I think what we're hoping for and looking forward to with the system is that we will have greater accountability on that, because it will be a very clear, this is now in your inbox. This is the date and time stamp that you received it. How long are you sitting for? The great thing with REDCap is we can also send reminder notifications. So we will be following up and working with programs to ensure that they are accountable to the timelines that they set and that review is done in a timely manner.
Thank you.
I really appreciate the questions and the discussion. So yeah. Is there one more, Tibor?
Are you going to send them like something like, we've been waiting for 47 days for your reply in red?
Yeah, something, or a phone call, or I mean, I will tell you that from the operational leaders we've been working with, they're very excited about this. They're hoping that this is going to improve communication, improve their ability to work with research teams, and to be able to support research across the hospital. So that's what I'm hoping we're going to get to.
Well, yeah, that's awesome. Well done, all of you.
Jen, can I just add a little note to Heather, just from a BC Women's context? Just because I think, Heather, to your area, and I know Catherine and I think Carola and Travis are on the call too, this doesn't replace the existing role of the WHRI and BC Women's research managers. They will continue to be that touch point. And ideally, like Jen said, at ideation, like when you're writing your grant, thinking about the feasibility of what you're intending to do with what the program is capable of. And because it starts there, and those folks are still there to help navigate this process as well. But I'll pause in case any of the other research managers wanted to step in. All right. I said enough then. Thanks, Jen.
Yeah, thanks, Nicole. Okay, maybe just because I don't want to run out of time, and I do, if there are other thoughts or ideas percolating out there, I do want to give time for the discussion. I'll just wrap up with my last few slides. my last few slides. Sorry, now I'm showing them wrong. Okay. So benefits. So some of these things that we've talked about already that we're really hopeful for this new system. So the ability to copy and paste from the REB submission, the ability for these things to happen in parallel, to have greater accountability and tracking of program approval timelines, to have metrics on active studies across our site, to have one submission, everything in one place, tracked real time in one location. And the flexibility to add additional programs and groups, recognizing that we have an ever-evolving landscape. Data may come under shared services in the future, but there would still need to be some kind of local approval and ensuring that we can facilitate and support those things as this changes. And I think even further to the comment about the data stewards and the approval processes, if approval processes change in our system, then we feel strongly that this REDCap system has the ability to be flexible and to make those changes and can be adapted in the event that where there currently is no approval pathway, if one were to be developed in the future, we could build it into this. Slide. Okay. So also in wrapping up, I just wanted to share also some tips for conducting research at CNW. Those of you that I know there's several on this call that have been here a long time, doing this for a long time, so may not be as relevant. For those newer to our site, here's some tips and tricks to help you along the way. We've talked about this already, but ensure you're submitting your IRAP application at the same time as REB. Make plans to communicate with the program, both before, during, and after the study. Before your study begins, get to know the program managers in your area, the nurse educators in your area. In particular, if you're unfamiliar with the area, we suggest that you consult on the planned logistics of your study before you even submit to IRAP, before you even submit to research ethics, so that you don't have to do amendments down the road if the program is requiring you to do things slightly differently. It's always best to clarify options for informing the clinical team about the new study. This is something we hear time and time again from bedside staff. They really want to know about the research that's going on our campus. They often talk about research being the best kept secret that we have here, and being able to share the information and being able to share what we're doing. Staff really value that this is a research hospital and that is where best patient care comes from. So make sure you're taking the time to inform the clinical teams about what you're planning to do before you get started, and the why this is important and how this will help their patients. During your study, we suggest continuing to build rapport with your clinical team. Look for opportunities that may already exist, like morning huddles or rounds or whatever the format may be within your given area, to get to know key individuals and to raise awareness of your study. And then I would say during and after, don't forget to say thank you to the involvement of the clinical team. Even when there is no involvement with the clinical team, so that retrospective chart review that we talked about earlier, the clinical team's interested to know the outcome of that. They're interested to know why you're investigating this. So make sure you communicate that and think about opportunities to potentially celebrate study milestones and to inform the program of the study findings. All of these things are going to help us build a positive culture of research where bedside staff really understand and value the contribution that research makes to improving patient care. In terms of IRAP next steps and feedback, we're at the stage I said, like we're preparing for kind of the final launch. We are looking for users who are interested in testing the application. So if this conversation has piqued your interest and you really would like to be involved and maybe have some time to spare, we'd really appreciate your input. The focus at this time right now, since we're getting very close to launch, is really going to be on urgent fixes and bugs. And then we were planning throughout the rest of the year to continue to refine and expand the system. So there's the contact email. If you are interested, you can reach out to us. Some of the future work that we are already thinking about and planning for the system that will come at a later date is the ability to submit an amendment to your application, the ability to have some kind of a check-in or study close at the end of your application. Again, as I mentioned before, this was really important feedback for our programs because they wanted to know when things came to a close. We will continue working with additional programs to clarify approval processes where things are still not clear, and also to help inform the build and development of us adding new programs to be within the IRAP system. And lastly, I just want to acknowledge all of the people that have contributed and been a part of this work over the many years, including the many number of people we have already consulted and worked collaboratively with on this. So thank you. And again, happy to answer any other questions from folks. I realize there's a long line of things in the chat, but I think Siobhan has been answering anything. Is there anything that got missed or overlooked? If you want to just maybe unmute yourself and speak up.
Yeah, I answered everything in the chat. The only question is if you're going to share the slides.
Yeah, absolutely. I believe this session is recorded as well.
Do we want a demo, maybe?
You guys want a demo? Should I use the last few minutes to?
Software.
Okay. Okay, so this is the home page. Never mind the orange banner. This is standard for any studies that are not yet up and running. So eventually that won't be there. But this is just the main landing page with some information and instructions. And then you get right into the portal. So the first section is really around the applicant information and where this individual is situated. Like I said, we want to confirm that this person is within our community at CNW. There's also an opportunity to identify a primary contact. So that might be the study coordinator or the person who's actually submitting this application. And also the opportunity to identify a billing contact. So recognizing that some service areas will require a cost for research services. And so if you have a different billing contact than primary contact, then you can enter that information as well. The next page kind of gets into the project information. So an overview of the project name, the Research Ethics Board of Review and the RAB number. And then we get into some of the questions around data collection. So again, the questions that we've put in here are very thoughtfully articulated to try and help guide study teams to identify what are the program areas that they need to obtain approval from. So the idea is to make this easier on study teams rather than having to say, oh, do I need to get approval from this group or that group? We've really tried as much as possible with the questions to lead and guide folks to understand what kind of approvals are required. So I just filled this out for a study that I was recruiting within the orthopedic clinic. And I was going to be asking for an X-ray for research purposes. So this is just a mock study that I've entered. So some information about the participants. We've asked some questions around interventions that might be given to this study. The quality office will be doing a review if it's an interventional drug study, for example. And if not, you just skip over that section and keep going. There's some question about devices, which is a flag for if biomedical review is required or not. And then some study service areas. So for this particular study, it's going to require an X-ray. So I've clicked medical imaging. And then down the end, once you've answered those questions, down the end of the form is the checklist of different programs. So programs that might be required for your study. So as I mentioned, we try to use this as a place to flag that you're going to be recruiting from the orthopedic clinic. So that will show up here to sort of trigger, oh yes, right, I need to identify that clinic as one of the program areas that are going to be impacted by the study. So they're all built out here. So you can click the appropriate ones and move on to the next page. For medical imaging, this is one of the programs that is built into IRAP. So you would click that it's the Children's Medical Imaging Department that you're using as opposed to one of the other research facilities, in which case it will take you to fill out a very specific form for the Children's Medical Imaging program. This is the section that we anticipate is largely where you might copy and paste what you've put into your RISE application into here to clarify your research proposal and protocol and what you're planning to do, or you can upload your protocol to describe your research recruitment plan, to summarize your study procedures or the visit schedule after recruitment has happened, and to summarize how you're planning to orient the program staff to the research. Again, whether that's because you need some support from the program to do something specific, or whether it's because you're just informing the program that this research is happening. And then there's also a box to summarize any knowledge translation activities that you might be planning at the end of the study. And then once you've completed that, you would submit your application. And after that, you get funneled to the requester dashboard. So this is the dashboard I was talking about, which is going to be your primary source of place where you go to see what the status is of your different programs. So for this particular study, you can, from your dashboard, you can link back to that initial form, that form that I just filled out. If you have any changes that are required of your application, that's where you would go. And then it shows you here, these are the programs that are built in within IRAP, and their program-specific form that you can link to if that is relevant, as well as the program approval status. So this one I haven't yet submitted, and this one I submitted and did a little changes required. So it shows that there's some changes and things that I need to address there as a study team member. And then at the bottom here is the list of program forms that need to be uploaded to IRAP. So the orthopedics clinic is one of them. So I would just upload and include the date that I've uploaded. And then when all of this information is complete, you can submit it, and you can also come back at any time and view this. Like I said, this will be the main place for study teams to kind of track what still is required and what is outstanding. If I click on these forms, then it takes you to specific information that this particular program is asking for related to the imaging requirements that you have. So you would fill out this form with the details and information. And then what you're seeing here at the top is what would appear, like this would not appear the very first time that you're submitting it, but if the program has any comments or questions or things that they need you to address in your ask, they could articulate that here. And so this is where you would see it and potentially make any changes that are required. Yeah, feel like that is the bulk of what I wanted to share. Any other questions popping up for people at this time?
There's a question in the chat. They just said, if I click submit, will the uploaded PUF go to the orthopedic clinic, or will I need to submit by email and upload to IRAP?
Yes, good question. So any of the PUFs that are not within IRAP, you still need to follow the old process by figuring out who needs to sign off on it, send it to the orthopedic clinic, have them sign the form, and then upload it into IRAP. So your upload to IRAP essentially replaces the need to email ethics. So you no longer have to then also email this to ethics. You just have to upload it to IRAP. And that's it once that's done. Hopefully down the road, we will be able to eventually integrate all of the programs into the system. And so there will never be a need to have that separate email system. But unfortunately, this is where we're at right now. And we wanted the opportunity to launch this sooner rather than later. Tibor.
Is there something that says thank you very much, like at the end, thank you very much, emails have been sent here, here, and here, as a feedback mechanism, or so people don't have to keep this in their head as to where things have gone?
So I mean, Siobhan, you can speak to that too, but I would say that's really what the requester dashboard is intended to be. So study team member can go at any time to that dashboard and they would see that the study is under institutional screening, or they would see that that's under program review, or they would see that one program has approved, but another program has not yet approved. It's still under review. So this is really intended to be the place where you go to sort of
Okay,
see
so at the end of this, does it say like something like thank you for your submission, you can keep track of your submission here, link?
Yes. So as soon as somebody submits the initial form, they are then sent an email that says, hi, you've started this journey, blah, 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 blah. Here's your link to your dashboard. Go back here at all times. And every single time they submit an individual program utilization form within IRAP, they are booted back to their dashboard, your dashboard. There's a lot of automation in this project. So depending on what people click and what options the programs fill in, it updates your status, and it also updates the date so that you can sit there and you're like, okay, I know I submitted my application to Tibor for review on, December 15th, it still says that it's in review. So I can poke, or you can poke the admin. There's also administrators who are responsible for the different program areas who are supposed to be monitoring this as well. So there's multiple levels. But yeah.
Fantastic. Great.
Julia.
Is there something at a program level, is there something we can be doing to move forward to being integrated into the system, or is that something that has to come from your end?
Absolutely. No, you can volunteer. So thank you. We're happy to follow up with you afterwards. I think one of the first steps for us is really clarifying with program leadership what their workflow is and what the approval looks like within their particular area. And as soon as that's clarified, then we can start working on build. So yes.
Awesome. I think we'd love to. And I see Lindsay Richter, our research manager, is on the line too, and we might work together to see how we can, that would be great for us.
Yeah, there was just a question about asking if they're uploading like their draft puffs or if it's the final approved, and it's you're uploading your approved paper puffs. If we're not, if they are not integrated within IRAP, it's only like once it's signed off. So instead of now sending those to REB, you're uploading them here. REB wants nothing to do with institutional approval anymore. They don't want to track if you have program approvals or once this launches. So that's what the system will have. So you'll have the separation as William touched on earlier, that, ethics does ethics, ops is over here.
Great. Thank you so much, everybody, for attending today. And please don't hesitate to reach out if you have any other questions or things that come to mind. We will continue communications. We'll be looking at different ways to communicate, including once we finalize an actual launch date. We've had conversations with ethics as well to make sure that we have a good transition once we actually go live. So thank you. Really appreciate it.
And thanks so much, Jennifer and Siobhan, for that presentation. And yeah, like Jennifer said, please feel free to reach out if you have any questions along the way. We'll just flag for everyone that the February Lunch and Learn session is going to be hosted by the Multilingual Research Team, which is a new team at Children's and Women's. There'll be some great tools and tips and tricks on working with interpreters and translators in a clinical research setting. Look forward to seeing you all then. Thank you. Have a good afternoon.